Hi, good evening, everybody. Uh, Welcome to today's episode of LimiHospital Instagram Live. So, I would like to introduce myself. My name is Dr. Melvin Nadamechi, a personal physician in Limi Hospital, and with me today is
Dr. Mbachine, consultant family physician, Limi Hospital.
thank you. Welcome once again. So, today we are going to be discussing a very important topic. Is not just important, it's an interesting one, I promise you that. And also, this particular Instagram Live is not going to be a unidirectional lecture, it's supposed to be an interactive one as well. So, we expect feedbacks from viewers, and then we expect questions, we expect comments as well. So today's topic again is we're going to be dealing with sexually transmitted diseases or sexually transmitted infections, as some persons also know it. So without wasting much time, we'd like to be dealing with that as well. So I'll give room for my senior colleague here to, give us an insight what this topic is all about.
Okay, so we are going to be discussing sexually transmitted infections, and we'll talk about it and telling you just give you an overview, like an introduction of what sexual transmitted infections are, including the definition. Then we'll tell you what can cause sexually transmitted infection, the symptoms that when you have it or notice it, you suspect that you have sexually transmitted infections and you can quickly go to a hospital to be checked out, and proper uh, examination and investigation can also be done. We'll also talk about the how you can get sexually transmitted infections, and how you can prevent it, and also the treatments for each of them.
Okay.
So sexually transmitted infection is actually, like the name sounds, sexually transmitted infection. That means you get it. It is transmitted through sexual intercourse. Sexual intercourse from one person to another, and it can be through oral sex, it can be through anal sex, and it can be through vaginal sex. So whichever route you involve in the sexual intercourse, you can get sexually transmitted infections.
Yes, okay, we've heard it all. In case you are just joining us, this is Limi Hospital Instagram Live. Um, and the topic for today is sexually transmitted infections. So, the family physician with me have already given us an insight as to what we are going to be dealing with today already. Sexually transmitted infection is an important topic that has been around for some time now. Um, there is a particular concern as to why should we be, be talking about this topic now. Why is it important that we know about this? Is simply because of how the rate of transmission, and so many persons have been involved, with it over the years, and also the burden in terms of what it can affect in someone's life in the end. Some of the symptoms of which we are going to be dealing with now, some of the symptoms are not immediate, but can cause a lifetime changes in someone's life, or anybody that is involved or happen to get any of these sexually transmitted infections, which we are going to be discussing shortly. So, just like we've mentioned, um, we would like to know, is there a particular concrete definition for sexually transmitted infections?
No, not like I said,
Yeah,
it's you define it, sexually transmitted infection.
yeah,
There are those infections that you get from sexual intercourse with
okay,
an infected person.
okay,
When you have sex with an infected person, then you can contact sexually transmitted infections. It can be through oral sex or through anal sex or vaginal intercourse. Some people feel if it's if it, they will tell you it's just the oral sex. So they
Yeah,
are free. When you do
that's
oral sex, you're free.
you
You know,
can
you
now
are not
put
you,
on protection for the
exactly
other
you,
part.
exactly. You don't do. You won't get the sexually transmitted infection, but it's not true. In fact, you know, you use condom when you're having vaginal intercourse or anal, but when you're doing oral sex, you're not
There's
protecting
no,
yourself.
yeah, there's
So
no concrete
the risk is
protection.
just there for you to get the infection through oral sex.
So, so very little again. So we're going to be discussing classifications. Uh, what just to have an idea as to maybe classification of types of sexually transmitted infections. Okay. The types are usually uh, the main ones that are usually commonly occurring ones are usually bacterial one and the viral one. Is there anything that, aside from these two ones, is there any other important group that we can also deal with?
Oh, well, that's if we're talking about sexually transmitted, the
Yeah,
commonest is the bacteria and the viral
the viral
infections.
one. Okay.
If you're talking in terms of sexually
Transmitted
transmitted
infection.
infections.
Okay. So the bacterial ones, from the commonest, we have the gonorrheal disease, also caused by the Neisseria gonorrhea. We also have the chlamydia infections. Also have other ones that are not so common in the household discussion. We have the lymphogranuloma venereum. Also have so many of them under the bacterial group. And then more commonly in the viral group, we have the HIV, we have the hepatitis, and herpes simplex virus, and other ones in that group. Also, aside from that, we also have the protozoa. Those ones are not so commonly occurring, but for females, like the trichomonas, they can also be a reoccurring thing as well. So there is the particular one I feel out of this whole thing. There's a particular heading that many of us will also be important. I know you've mentioned it already. It's just to highlight a different aspect of it. That is the means of transmission. Apart from the sexual routes like the oral, the genital, the anal route we mentioned, is there any other means through
Yes,
which this
yes, there
this
are other means of transmission apart from because we're discussing sexually transmitted infections. That was why we limited it to
yeah,
sexually transmission. There are other means of transmitting some of all these infections, like
okay,
blood transfusion. Those that abuse drugs,
IV drug
IV
users?
drug users,
Okay,
it can get you through that means also. Then blood transfusion, it can also get you through that.
okay. That is most likely if the blood is not well screened,
Well
if it,
screened, yes, and they transfuse the blood to someone that is not infected, then you can get infected through that means.
okay. So these are apart from the normal common occurring ones, the sexual routes we've talked about. There are also some other means which we've already pointed out now. So even though the title or the name is sexually transmitted infection, it does not really mean that specifically it must be through sexual means. It can also
Yes.
be through other means, and that's what we've pointed out now. So next thing we're going to be dealing with is some of the symptoms of these infections, sexually transmitted infections. And the what this means is some of the things one could see or notice that might suggest that there might be a likelihood of a sexually transmitted disease or infection. So we are going to be looking at it under different particular cause. If we pick a particular organism or likely cause, we'll try to point out some of the symptoms one could see. These symptoms, I would like to say that they are not specific. We can't say, okay, if it is there, then that means that there is an STI going on. You can't categorically tie these symptoms to only sexually transmitted infections. No, but when they are there, especially when one or two of them are there, it can become suggestive, and then there need to do something about it. Okay. So next, first one we want to talk about is the gonorrhea disease. Is there anything you'd like to say about gonorrhea infections, how they present?
Okay. So, gonorrhea disease is, which is caused by Neisseria gonorrhea, is the commonest STI in Nigeria. And the symptoms, sometimes the is somehow silent in females. They mistake it for the normal vaginal discharge, so they don't get tested. And unlike when it's present in a male, the symptoms are quite different. In females, you just maybe you might have vaginal discharge, you might have pain while you're urinating, and discomfort, and all that. But if it's a man, you see there will be a discharge from your penis, and you will have painful, that's the pain is usually what brings them, not
Oh,
even the
yes.
discharge. They'll tell you they can't pee. There is this burning sensation they have when they want to urinate, but you don't get that
Dramatic,
dramatic
yes,
symptoms
in
in a woman.
females, yes.
So the woman might not know, and you are just, there harboring the infection inside. Is causing more the damage. It can migrate up, cause more, especially if the person is pregnant. If the person is pregnant and you meet, maybe your husband has gonorrhea and gives you the gonorrhea, you might just think it's the normal vaginal discharge and you don't do anything about it. Then the organism will migrate up, and the baby, when they give birth to baby, your baby will have what we call the ophthalmia neonatal, the copious eye discharge. Some of them, it causes blindness if care is not taken. So it's always good. That is why when we're treating, if we're treating one partner, we always advise you to tell your partner, your sex partner, that this is what you tested positive for this, so that that person can also take medication to avoid complications. Complications that you might not see as an immediate complications, but long time damage and all that, infertility and all whatnot that it will lead to.
It's okay. So there's something that I want to pick two things from what you've said. You made mention about the fact that if two partners are involved, some of these infections can become very evident in one partner and not so obvious
Yes,
in the other partner.
yes,
And that's why most times in treatment, we treat the two, not just
not just one person.
one person
Yes.
and the other person. Thank you very much. So, in case you
And
are just
also,
okay,
if you treat one person and you don't treat the other, then you engage in sexual intercourse again. That person that is not treated will
again is
reinfect the one that is treated. So it's always good
to
to treat
treat.
the two people involved.
It's okay. So another thing is for females, why this topic is also important is that for females, is it becomes very very important because there is a chance or likelihood of a childbearing lady to pass the infection to
To the
the baby,
to the baby, yes.
can become a huge morbidity issue for the baby as well. Like we pointed out in this gonorrhea infection, there is usually a chance or a high chance or probability of an infected mother to pass that on
To the child,
to the
yes.
child as time of birth. So thank you. So if you are still joining us, this is Limi Hospital Instagram Live. My name is Dr. Melvin Adamechi, personal physician here in Limi Hospital. And with me is,
Dr. Mbachine, consultant family physician, Limi Hospital.
yes, okay. So feel free to drop your comments, your questions, we'll address them as time goes by. Okay, so moving on, we want to also touch some other bacterial infections that can be transmitted sexually. So one of another thing, although it's not so prevalent now, but it's also important to address it, to talk about it. Syphilis infection. What do you have to say about syphilis infection?
Okay, well, the infection is, although like you said, is So many people are aware. So it's not that common, but it is still there.
Yeah.
It's not that common. It's still there. That you usually the symptoms you have is a painless ulcer, like a wound. You find it on the affected parts. It can be in the vagina, it can be on the penis, it can be in the mouth, then it can be on the skin. So depending on where, that's the first sign, the first one that usually happens
An ulcer.
is yes, an
Okay.
ulcer.
Okay.
Like what's a layman, what you call a wound,
Mhm.
an ulcer, a wound that is not painful. It's just painless unless there is a superimposed bacterial infection, then
That
it
will
can
become
become painful.
painful.
But it's usually painless. You can find it in the genitalia or in the mouth. The same with the male, you can find it there. Then it can progress. It can progress to general the rashes that you have, generalized body rashes that you have. If it's not arrested at that initial, that primary,
Time when it's
yes,
still just.
yes, when it's still at the primary level, if it's not arrested, it can progress to the generalized, the rashes and all that. If that one is not also managed properly, then you now have the systemic symptoms, which can affect the heart, the brain, and all that. So it's always good when you notice an ulcer in your penis, in your vagina, outside your vagina, in your mouth, visit a hospital. Let the doctors check it out. It's better you're there and they examine, then tell you, oh, don't worry. It's just this. No, it's not something serious. It's just mild. It's better than ignoring it, thinking that it's something normal when it's not. By the time you realize it's not normal, it has gone to the secondary stage or the tertiary stage of it.
So speaking of ulcers, there are so many. There are other um, bacteria, especially bacteria sexually transmitted infections that can also cause ulcers at the genitals or any other part of the body. Most other ones include the chancroid, also the herpes simplex virus. Also, when they affect this, when one contracts, then it can also manifest as ulcers, depending, can be painful or painless as well.
And ulcer of the chancroid is the difference between the ulcer because it's similar
Yeah.
with syphilis. The ulcer of the chancroid is usually very painful, unlike the syphilis that I said that is painless. The one of chancroid is usually very painful.
All right. So next thing, we are going to be discussing some of the viral sexually transmitted infections, and then we are going to be looking at the symptoms they also present as well. Okay, and what the next one we want to talk about is the hepatitis infection, both B and C, and how they manifest, and some of the symptoms of them. So firstly, some of the symptoms like we're going to be outlined are not so specific. They will not give you a direct a specific symptom to say, okay, this is hepatitis infection going on. But again, just like we said, when two or more of these symptoms are present, it tends to suggest that something is going on, and it would be advisable for such a person to go to a hospital and get screened. Okay, so what do you have to say about hepatitis infection as well? The viral infection.
Hepatitis infection is can be gotten um, through sexual intercourse and also through blood transfusion and IV drug users. And the thing about hepatitis B, in the early stage, you might not be able to, if you don't test for it,
Well,
you
not
might
really.
not know that the person has hepatitis B because you just come with the normal symptoms like, maybe body aches, poor appetite, pains, and all that. It's when it's progressing that you now start having the yellowness of the eyes, the abdominal pain at the side, the part of your abdomen where the liver is located, and all that. That's when you now start developing all that. But if you check it, if you check your if you check the hepatitis, if you do test for
The
it
screening,
in
yeah.
the screening on a regular basis, or you do when you do the screening and it's negative, you take the vaccine, 3 doses of hepatitis B vaccine to prevent against the hepatitis, which is better than not taking the vaccine and getting the infection. And the vaccine is free. If you take it from, if you go to government hospitals for it, it's free. The
Yes.
vaccine.
Vaccine. Okay.
Because when it gets to, if the advanced stage will lead to liver, you start having liver problems, liver cirrhosis, and all that, which can also lead to death. So prevention is
Prevention. So,
better. Yes.
so just like we said, the best way to address this particular is early screening, prevention, but and also early detection. So
Yes.
once it's detected early on time, one could actually get treated, and then we're going to be dealing with the treatments later on. We just want to, just talk about a little bit how these diseases actually present, and that's why we're talking about that. So next, we are going to be dealing with this particular one that also this is a particular topic. Okay, before we move to the next topic, please, there's something I forgot to add. For the hepatitis uh, uh, infection, we give vaccine. Yeah, how we do it in this place, we have, if anyone comes around for the hepatitis B vaccination, as you are scheduled, you are put on a schedule, and then you get your 3 doses, just like the family physician pointed out. And then you first of all get screened, and then after the screening, we'll do some background checks, which will include viral load, then ascertain the level of the, and then you'll be put on a schedule for the vaccines as well. So moving on, the next we're going to be dealing with talking about the HIV infection. Also, is part of, we can talk about sexually transmitted infections and leave this one out. It's an important one. So just again, just like we said, just like most viral infections, the symptoms earlier on will not be specific. They might not even manifest earlier on, and even if it does, it's not going to give you a specific type of symptom. But along the line, it might become more obvious and very obvious as well. So, is there anything you want to add concerning the HIV infection?
Okay, for HIV infection, since the symptoms are not specific, but when you're involving in unprotected multiple sexual intercourse, or you have multiple sexual partners, or for those that are the sex workers, commercial sex workers, and all that. So you have to check it. You do some do 3 monthly. You check your HIV status, because it doesn't show, it's asymptomatic. It doesn't show symptoms in the early stage. But if you know that you're involving in unprotected sexual intercourse, it would be wise to do the screening. Early detection is the key. If you detect this early, you start the antiviral, and you can have a normal life.
So that is just that we are going to also be pointing out another viral infection, but this one is particular with females in particular, and is the human papilloma virus. It comes in different subtypes. So there are ones, but usually it is sexually transmitted. And why it is very, very important is because in itself, the infection can actually predispose a young lady, to a more a serious morbidity, which is the cervical cancer. So that's why we want to also address and talk about it. Many people don't really talk about it as a sexually transmitted infection. Most attention is on the other end, which is the cervical CA. So, but today we want to also, address that a little.
And there's also a vaccine for it that
Yes.
you're supposed to give to your children from nine years. The one that is called HPV vaccine. You're supposed to give it to, especially your girl child, but you can also give it to the boy child. or
Okay.
is mainly for the girl child to protect them against the risks of cervical cancer
Yeah, right.
in them. Yes.
It's okay. So next thing we are going to be addressing is some of the what are ways that okay we've actually addressed these infections. Next thing should be okay, how can we pick them as early as possible? We've already mentioned severally about early detection, early detection. So what methods are available that can help pick these infections as well? So some of the lab investigations that are available include microscopy, culture, and sensitivity testing, especially the bacterial infections. We also have serology screening testings. We also have DNA testings as well. Also, and these investigations are done most times at depending on um, persons that are at risk, or if there is, just like we told you, that some of these symptoms might not be so obvious at first, but when they are suggestive to a medical personnel, it becomes important to actually do a screening for them. So some of these tests is what we try to do as early as possible to screen them, which I've already mentioned, the MCS, the microscopic culture and sensitivity. Also for the HIV, we'll do the retroviral screening test, the syphilis, we'll do the VDR test. As well, the hepatitis, there is a hepatitis B surface antigen test and a hepatitis C virus serology as well. So if is there anything you want to add concerning the investigations, Lord?
Okay. Another thing is, some people come when they come and meet you in the consulting room. They tell you I want to test for STD. You know, there's no one test there is no one test to test for STD.
There's
Is when
to test for all the STDs.
one test to test for all the STDs. No, there's no such test. It's from your presentation and the history you're giving the doctor and the examination, the doctor will know which test to do. Is it a vagina? Does he need to maybe take a vaginal swab and do a culture? Or if there is an ulcer, like a wound, just take a swab from that, or oral. Maybe if the wound is in your mouth, they can take a swab from that too. They might need to collect blood to do some tests like the VDRL, hepatitis B, the HIV test, all those ones. You can do it through blood. Some they might just need to take a little, it's like a skin scraping. Then you can view under microscope and all that. So there is no particular, just one test to test for all the STDs. No, it depends on what you're presenting with, what you're complaining about, and the examination findings will now depend on what the
Need to
doctor you're
test.
seeing is going to do to find out which organism, which organism, the bacteria or the viral, then will now give you the appropriate treatment that is needed.
So, thank you very much. So the family physician has already pointed out what we do here commonly. So basically, it depends on the symptoms, uh, the complaints. It has to do with a discharge, a part of it is taken to the lab. Like what we do here, sample of it is taken to the lab. It's allowed to grow there for 48 hours, and then possible potent antibiotics is also suggested from the lab test, and then the appropriate and antibiotics is actually given for a particular period of time, and then subsequently there is usually also a follow up to uh, those treatments as well. So apart from that, um, just like we've already said, there's no general or specific test to do for every other thing. If there is a likelihood or if there is any suggestive symptom or one or two that will require taking a particular body sample to do a particular test, then you'll be told, and then if you are having any of these symptoms, it will be advisable you just go to a good hospital, and then you get screened. And also there are different entry points too that screening is done, whether there are symptoms or not. It's just because of the concern and importance of this particular topic. For instance, the antenatal in antenatal visits, the first thing booking is to do all these
All these tests,
checks.
yes.
Yes, it's just because, just like we told you, that the issue of the mother to child transmission is a very, very important thing, and usually we try to become very concerned about that. So we also do screening at those points as well. Blood transfusion, definitely, any blood is totally screened before transfusion. Just like we already pointed out earlier on, that it can also serve as a means of transmission. So next we are going to be discussing is what are some of the possible treatments for some of these STIs. Yes, we've already talked about what it is. We've already addressed the mode of transmission. Also went into details into symptoms, some of the common symptoms of some of them as well, and then also actual, giving us a particular idea on how some of these testings are done as well. So next thing is treatment. How can STIs be actually treated?
Okay, for the treatment, if for bacteria, the ones caused by bacteria, it's antibiotics that is used. But
Okay.
you don't use, there's no one antibiotic for all of them. The antibiotics you use is dependent on the organism that was cultured during the lab test. That will not determine which antibiotics you're going to use to take care of that infection. For the viral infections like HIV, we already have the drugs, highly active antiretroviral drugs that is used for it. Hepatitis B and C, there is also drug now for it, antiviral drugs that are used for it. After you have done there are some investigations you're supposed to do including the abdominal scan, the viral load, and all that. Then, if you meet up the criteria for the treatment, then they put you on the antiviral for hepatitis B and hepatitis C. There's treatment for it now available for it. So, depending on which one, if it's depending on the bacteria that was cultured, you know the antibiotics to use. If it's viral, which of the virus too. You also know which
Which one
antiviral
that
to
to
use
use?
for it to take care of the infection. So the treatment is dependent on what you're being treated for.
Okay, so that's basically that. So it depends on whether it is a bacterial or viral origin that is causing the infection as well. And the only way to know is through appropriate lab testing.
Testing, yes.
So it's not just, and also it's not one medication that deals with every other thing. No, it's based on the result of the lab investigations that one could also, okay, take this particular medication for so period of time to be able to address it. So usually, what we usually say everywhere is that prevention is usually better than cure. So uh, before we get to this stage, we can actually avert it if it is prevented very well. All right, so there are levels to prevention. Usually we have the primary level, secondary, and so forth. So in the primary level is just creating an awareness about sexually transmitted infections. Letting everyone know that these diseases and infections are still around us, even though year in year out more diseases are coming out, even as pandemics and very loud and all that. But still, these ones are still amongst us, and because of how serious they are, especially, and how fast it can spread from one person to another, it becomes important that it is discussed. So, primary prevention for this has to do with awareness, health education. As if you are listening to us already today and you've picked one or two things, you can go home and also share it with anyone around you. You are also free to also um, you know educate anyone close to you. And if you also have questions or you are in doubt about one or two things or you need clarification, if you have a clinic around you, you can go and ask any medical personnel some questions about what is going on, and then you get a better insight as well. Okay, so then after the primary prevention, next is the secondary prevention. That is when we've talked about vaccination as well. Like, just like I mentioned earlier here in Limi, how we do it. For instance, some of the viral infection like hepatitis we've mentioned, we'll have vaccination schedule for it as well. So when someone comes, you can do a background check, and after that, you can put on a schedule for that as well. And also, just like the family physician had already pointed out as well, other conditions like the human papilloma virus, the HPV, also have a vaccination to help prevent even the more serious morbidity, the cervical cancer as well. So these ones are targeted towards the specific organism. Also, then generally, the use of protection, also helps in the prevention as well. Use of protection during sexual intercourse, because just like we've talked about, most of these infections are gotten sexually. Okay, so and then especially unprotected sexual intercourse. So use of protection like condoms, there are also female condoms as well. They can also help to curb that as well. So in case you are just joining us, this still remains the Limi Hospital Instagram Live. We started earlier on and the topic today we've been discussing was sexually transmitted infection. We started earlier on by defining what it is, which is simply sexually transmitted infection gotten through sexual intercourse, maybe oral, genital, anal. But aside from this, what we've also realized is that the other means through which sexually transmitted infections can also come about, which include blood transfusion, especially if someone that is infected is transfusing blood to an uninfected person, mother to child transfusion, probably through childbirth or breastfeeding, and also sharing of sharps, especially amongst IV drug users, and so on and so forth. We also discussed the classification, which include the bacterial and the viral groups as well. We also dealt with a few of the symptoms, and then we would like to also, in this point, I also suggest that if you have been following us and you heard some of those symptoms that we mentioned, or you know someone that have one or two of those symptoms, there's nothing stopping anyone from going to a health facility and getting screened. So when you go meet a health personnel and they get screened, then if there is an infection going on, it is detected early and appropriate treatment is given as well. So, is there anything that we didn't really address so far that I'd like to touch on?
Well, another thing to add on the prevention, when using condom is not 100%. It's not a. You don't say it's because I'm using condom. Why should I get STD? No, condom is not 100%. Doesn't give 100% protection. The only thing that can give you 100% protection is abstinence from sex. That's the only thing that can give you 100% protection. Condom cannot give you 100% protection. It can only reduce.
Reduce
Yes,
the okay, the
reduce
risk.
the risks of you getting it, but not giving you
Totally
100, totally,
100%.
yeah, 100% from preventing it from preventing you from getting it. No, it's only abstinence that can do that. Condoms,
Okay.
fine, will reduce it, and depending on which condom too you're
The
using,
quality.
yes, the quality of the condom you're using, so you've seen cases where a woman that wasn't planning to get pregnant got pregnant because the condom tore during sexual intercourse. So it's the same way. The condom can
Break.
have a break,
Yeah.
and you still contact. You can have a small break that you didn't notice during sexual intercourse, and you can still contact the sexually transmitted infections through it.
All right. So at this point, we'll also be encouraging us to bring in questions so that we also want to know your thoughts as well, comments, questions, so that we actually be sure that this is actually an interactive section going on. Because so far, it has been a unidirectional interaction. We would like to also get some feedbacks from you. So if someone is asking, if someone is experiencing pain during sex, does that suggest that there is an infection going on
No, having pain during
during
sex
sex? Yes.
doesn't really mean that you have a sexually transmitted infection. It all depends. Is it just the pain you're having?
Okay.
This pain, is it the same? Is it a new partner you're having, or this is the same partner you've had for
Same.
since, and you haven't experienced this pain with him or her, with him, and now you're experiencing pain while having sexual intercourse? Any other symptoms coming with the pain, like maybe vaginal discharge? Sometimes what women call normal vaginal discharge is not normal vaginal discharge.
Okay.
So it now depends if the person is having the pain with some other symptoms like vaginal discharge, or is having that pain with suprapubic pain, your lower abdomen, you're also feeling pain there, or you feel pain when you're urinating. So all that will come together to
So,
make diagnosis. So you can also see a doctor, let the doctor examine you, and
okay.
get some other questions, ask you some other questions, and examine you. Then you can arrive at a right diagnosis.
Okay. So, in all, this it mustn't be that the pain during sex will translate to
Yes, to sexually transmitted infection.
sexual transmission.
Yes,
So, thank you very much. Another question from one of us, it says that if someone is on pill, that is contraceptive pill, does that in order to protect, I think what the question is talking about, as the pill is protecting the person from getting pregnant, does that also confer protection to sexually transmitted infection?
no, it does not. The pill is only preventing you from getting pregnant, not sexually transmitted infections. It's only the barrier method that
Okay,
can prevent
like
sexually,
condoms.
like condoms, both the
Okay,
male and the female condoms can prevent sexually transmitted infection, not pills.
not
Pills
pills
cannot.
at all.
No, pills cannot. They just prevent you from getting pregnant, not
Not the
sexually transmitted infections. No, it cannot.
okay. All right. So that being said, so I feel that maybe this is a particular recurring question one usually get, like when you take the medication, is there a way maybe probably somehow is boosting your immunity along the line, and then as such you become untouchable. And then that reminds me, there's this another common recurring question: is there a possibility to take some antibiotics prior to unprotected sex to have a kind of protection?
No, if you're the, how do you know the antibiotics you're taking is going to protect you
You know,
from? Do you even know which of the STI you're going to
that's
contact during that particular sexual intercourse? So it's different antibiotics for different bacterial infection. If you're taking these particular antibiotics,
okay.
it might not be
Be as effective for that.
effective for the bacterial infection that you're going to contact from that particular sexual intercourse or from the partner you're dealing with. So, taking antibiotics as a prophylaxis
Yes.
to prevent,
Prevent. Okay.
it does not,
Doesn't work out.
no, it doesn't work out.
It's all right. So, in case you are still joining us, you are just joining us. This Limi Hospital Instagram Live, and this is our question and answer section. And the topic we've been discussing so far is sexually transmitted infections. So, your questions are, well, even though you are just joining us, you still feel free to ask your question, and then we'll try as much as possible to answer them accordingly. All right. So, next question is, is there a difference between STD and STI?
No, there's no difference.
There's no
STD, that are sexually
the
transmitted
disease.
diseases. Then it was now changed to sexually transmitted infections. There's no
Okay, there's no
difference. There's
difference.
no
Still the
difference
same
between
thing.
it. They are the same thing. There's no
So
difference between them.
there's no
They are
difference.
the same things. Yes.
The next, okay, another question is how often should I get tested for an STD?
Well, to get tested,
Hmm,
you can get tested for, let's say, gonorrhea, chlamydia, syphilis, maybe once a year. But if you're involved in multiple unprotected sexual, you have multiple sexual partners, and you're practicing unprotected sex, or maybe you are a commercial sex worker, you can test yourself every 3 to 6 months to check whether you've been exposed, whether you have any of the sexually transmitted infections, so that you can start treatments immediately to avoid complications. But if you are
okay.
not in that group, the
High
high
risk
risk
group.
group,
Okay.
there's no need. At most, you can do it once a year. You just check maybe for syphilis, chlamydia, and all that. But if you
Okay.
have vaginal discharge, don't say it's a normal vaginal discharge. Go to a hospital, see a doctor. Let the doctor examine you and tell you that that vaginal discharge is normal. So don't assume that you're having a vaginal discharge. You say it's a vaginal, or you call it toilet infection. No. Visit your doctor. The doctor will examine you. You can do a culture. Then we can now give you a appropriate antibiotics for the organism or for the bacterial infection that you're having.
Sorry. So, Editor, that's a alone answer the question, the initial question, which is there, okay, well, first question, the question initially was, is there a difference between STDs and STI? We said there's no concrete, there's no difference. They are still the same terminologies as well, and they are still talking about the same thing as well. The other question we talked about is there use of pills, that is pregnant contraceptive pills, does it confer uh, protection against STDs? We said no, it serves a different function. We also addressed the issue of taking medications prior to unprotected sexual intercourse. That does not help at all because the medication, the antibiotics, whatever is taken, that it might not be directed against the particular uh, infection one might be exposed. So we're going to look at the next question that we have before us. Is it true that some STDs have no symptoms at all?
Well, if you say at all, you might have, when you say without symptoms, the person might be having what some women call normal vaginal discharge.
Okay.
So that is no symptom. You're
To the
calling it
person.
to the person. You say it's normal vaginal discharge, but you cannot say it's normal until you're tested. So with that, if it's just the normal vaginal discharge, the person is calling it, then with no other symptoms, no pain, nothing, just that, then the person will relax and think there's nothing wrong until it progresses
Yeah.
to an
So
advanced
very
stage and
serious.
all that ahead. Then it becomes serious, and you now require a more higher intervention than what you would have done when if you went to the hospital early. So if you have vaginal discharge, whether you think it's normal vaginal discharge, like I said earlier, go to your doctor. Let your doctor examine you and tell you that it's a normal vaginal discharge. Then there's nothing wrong with that.
There's also a concern, like for instance, like HIV infection. There are times there's a window period. Most times, immediately after exposure, during the window period, there might be no obvious symptom, but the person might have been infected.
Yes, the person will still, the person is still, that's why when you do the test, If you
Okay.
do test now, you person comes back after 3 months for
Okay.
the confirmatory. You do the one that for 3 months. After that 3 months is when you can now say,
So,
because if you do it now and it's negative, the person might be in the window period like you said. But when you now repeat after 3 months and it's
okay.
still negative, means that person is actually negative. But you
Okay.
can do it now and it's negative. After 3 months you do it and it's positive, means that person was actually in
Okay.
the window period. Yes,
Yes, actually.
the first time you did the test.
That's okay. It's all right. So please keep bringing on the questions. We are here to look at them and also comment and ask them as much as we can. So you say, if I receive treatment for an STD, does that mean I can't get it again in the future? If I've been,
No, that doesn't mean you can't get it in the future. If you receive treatment, the treatment you're receiving is for that particular STD, STI you're having. That's
for that
sexually,
particular one.
yes, for that particular sexually transmitted infection that you're having. That is
Okay.
what the treatment is for. Because there's the ones they guarantee that the next time you have it is the particular. It's like now you contracted gonorrhea, then you were treated for gonorrhea. Next time it might be chlamydia or syphilis,
It
different
might even
treatments.
still be the same.
It
Yeah.
might exactly, it might still be the same gonorrhea. So because you just treated the gonorrhea does not mean you cannot get the gonorrhea again. It
Yeah.
does not mean you cannot get a syphilis. Doesn't mean you cannot get chlamydia. So treating it does not mean you cannot get it. No.
So far, thank you for being with us so far. We are still on it. Remember, this is Limi Hospital Instagram Live. And the topic of today has not changed yet. It's still the sexually transmitted infections. This is a question and answer time. We've been so far tried to, as much as possible, to address some of the questions that has been coming in as well. So we're going to look at the next question, and that is a cold sore an STD?
Uh, well, no, it's
Cold
not
sore.
counted among. It's caused by herpes simplex virus 1. It's
Okay,
not.
the one. Okay,
Yes, the one.
okay,
It's not included among the sexually transmitted infection. It's the herpes simplex virus 2, the one that
okay.
causes
Yes.
genital herpes. That's the one that is under sexually transmitted infections. This can also the cold sore can get it through contact, but not it's not among sexually transmitted infections.
Okay, but okay. So anyone that has it cannot say that. Okay, this is sexually transmitted.
No, it's not.
Okay, that's all right. So far, just like we said, even though some of these symptoms they cannot on their own cannot stand alone as as a sexually transmitted infection, they may be present. They may be present with other symptoms as well. In that case, it becomes suggestive that will advise such a person to go for a sexually transmitted infection screening. But if it's on its own, we can say, okay, well, I'm trying to be sure that it's not what we are talking about that is going on. So next question is, my vaginal discharge is a different color than normal. Does that mean I have an STD?
It's just what I was talking about. The person is asking, my vaginal discharge is different color than normal. Normal. That means she has been having vaginal discharge that she's calling normal.
Normal. Then
And
this one
now the
now
color
change.
has changed. So she's now calling it abnormal because the color has changed. So we cannot say whether it's sexually transmitted infections until you need to go to a hospital. Let a doctor examine you, see the discharge you're talking about, collect sample for culture and sensitivity, then appropriate treatment can be given to you. Please. The color has changed, although you didn't say which color, but as long
Yeah.
as there is vaginal discharge, which was there, and now has changed color, you need to see a doctor. let the doctor examine you and collect sample, run some tests, and can treat you properly to avoid complications that
Okay.
can damage your womb and cause infertility in future.
It's okay. Another thing that I just thought about is there's another thing that keeps on coming up. The issue of toilet infection. Sexually trans. Is there what do you have to say about it?
What they usually call, what I've noticed, they usually call toilet infection is vaginal candidiasis. That's
Okay.
what they usually call vaginal toilet
Toilet
infection.
infection.
Yes, it's
Okay.
vaginal candidiasis. When they are having discharge, itching, most of them call it toilet
Toilet
infection.
infection.
And because they call it toilet infection, they just keep quiet. Some of them just visit all these chemists, patent medicine vendors, and they give you some cream and all that without actually knowing.
Testing it.
Yes,
Yeah.
testing it to know what it is. So they just, because it's toilet infection, it's not serious, and the person takes the treatment from the patent medicine vendor, which might not be adequate to take care of what the problem is. So toilet infection, vaginal discharge, whether it's itchy, you feel this hot sensation, you feel pain when you're having sex, visit your doctor. Explain all these complaints to the doctor. The doctor will examine you. He might need to use a speculum and to open and see the inside of your vagina. At the same time, he or she might need to collect some swab, a sample with a swab stick, then run some tests, culture and sensitivity, then place you on antibiotics. And at the same time, the doctor might also tell you to bring your partner so that your partner can be
Yeah.
treated as well. If not, if they treat you without treating your partner
There
and
can
you
be
go back
infection.
to your partner, if it's your partner that infected you, the partner will reinfect you again. So it's always good to treat your partner alongside with you to prevent reinfection.
Yes, okay. So it's as though we are talking more of the females, but uh, we are moving with how the topic is moving actually. So there's another thing I want to, why I'm saying it because another question concerning females too. Does sexually transmitted infections does it affect menstruation in any way? The flow or the regularities of the period, does it in any way affect it?
Unless there's an infection, unless the infection has
Okay,
migrated up.
okay,
You understand? Maybe you're not having a pelvic inflammatory disease that is already affecting maybe the uterus and all that. Fine, that
okay,
can alter.
okay. Can
Yes,
alter
it
the
can
flow.
alter the flow of your
Okay,
menses. But if it's still within the vagina, no, it will not.
okay. So there's a possibility of it
Yes,
affecting. Okay,
depending on which
okay.
of the sexually transmitted
An
infections
infection.
you're having.
Yes. Okay. Okay. Another question is: can STDs be transmitted through oral sex? Someone is asking, can STDs be transmitted through oral sex?
Yes, STDs can be transmitted through oral sex. From, if let's say if it's someone that has if if the male partner has let's say rash, all this syphilitic rash around the penis, and you're doing oral sex, you're having close contacts with
With
those lesions in your mouth, and also the person is going to release the semen,
containing the
yes,
okay.
into your mouth. So you can have oral herpes, can have oral thrush. So yes, it can be transmitted through oral sex.
Okay, so that's the answer to the question. There's a possibility of transmitting sexually transmitted infections through oral sex as well. So, in case you are just joining us, this still remains the Limi Hospital Instagram Live. My name is Dr. Melvin Adamichi, and with me, the consultant family physician, Dr. Mrs. Mba. We've been discussing sexually transmitted infection. We've already talked about what it is. We've also talked about the means of transmission, um, sexual means and also other means which include sharing of sharps, mother to child transmission, blood transfusion as well. We also discuss the symptoms as well, and also we'll address the some of the lab investigations done to pick it up or to detect it early. Also, we've also discuss the classes, different types of sexually transmitted infections as well, and then also giving us an idea as to some of the preventive measures taken to cope these STIs as well. And now we are on our question and answer section. So I feel that we don't really have much time on our side anyway. So I'll leave the floor open to the my senior colleague to just give us a closing remark on this particular topic we've been discussing so far. What do you have to say, man? I haven't talked about this whole thing.
Okay, well, I hope like what we're doing now is like creating awareness, which is part of prevention. And I hope at the end, if you have listened to us, if you have any of these symptoms that we have explained, whether it's you or your partner, you should encourage the person. It might be your sister, it might be your friend. Encourage the person to go to a hospital to be looked at, for a doctor to examine and run some tests, and adequate treatments will be given to the person to prevent complications. Please, to prevent complications.
It's
So,
okay. So thank you for joining us today. This today's edition of Limi Instagram Live interactive class. Please do join us on our next episode as well. Also, just like a reminder, we also have our HPV vaccines available. Just like we mentioned earlier on, it is important. We usually also
and
schedule persons and also give
do
the
it
vaccine.
during our morning health walk.
Yes, that's the time we usually do it as well. Also, we also have our health work also coming up. It usually comes up at the end every last Saturday of every month. So next one is next week
On 29th,
on 29. So
and it's
please,
free.
it's very free. So
Free to
do
join.
join us. Come and exercise your body, shake your body, and be happy with us as well. So
Thank you,
thank you very
and
much.
have a good evening.
Uh,